Okay. So let's see. Let's go ahead and get started. So hi, Dr. Alexa. It's a pleasure to meet you virtually, and thank you for your interest in our department. So I wanted to just give you a little bit of background about our department, our mission, et cetera. So we're very proud to be a teaching facility, and we're very proud to provide what we consider the most accurate interpretations in neuroradiology. We are a patient-oriented practice and work on technological advancements in neuroradiology. We provide minimally invasive therapeutics and work to train the leaders of the next generation. So education is very important to us. In terms of our department, we currently have 25 staff neuroradiologists, which are involved with educating our fellows and residents. And we have 7 fellows per year. We also have roughly around 24 residents that rotate through our department. It does change a little bit from year to year. And we do provide dedicated academic time to our faculty. As somebody who's a junior faculty member starting out, we would provide roughly about 1 academic day a week. And we would encourage you to use that for educational and research opportunities. A little bit more about our hospital. We have main campus and 2 satellite hospitals. Our main campus is a 1,000-bed hospital and a level 1 trauma center. Our 2 satellite hospitals cumulatively together have a
Oh, we lost Jen.
Dr. Nathan, it looks like we lost you.
She had an internet connection before, so she might be right back.
Do we want to maybe move on to the private practice for now and come back to the academic simulation? Dr. Alexa, you're muted.
You can recall and just see what's going on before we kind of swap around. I'm just worried we're going to lose one of the sessions if we do that.
Apologies. My computer died and I had to restart it. Jen, could you please place me back in Dr. Murov's breakout room?
Okay, she's gonna try logging in again. Her internet dropped. Who was asking to be placed?
That's me, Chelsea Schmidt. I
Okay.
was in Dr. Murov's room. Sorry.
No problem.
Thank you.
No problem.
This is probably a pretty good simulation of how what can go wrong with doing interviewing over Zoom and Teams. And in the meantime, I will just tell you, anybody who's listening, that if you're given the choice, and I know sometimes in residencies, they don't want to give you a choice because they want everybody to be treated exactly the same. But if you have the choice, interview in person, interview on site. Because one of the things you want to do with interviewing is make sure that you get as much information as you can. I saw Dr. Nathan just come back up.
yes. Can you hear me now?
You sound great. So,
Okay. Perfect.
go ahead.
Oh, where did I lose you guys?
We lost you when you were describing the size of the program and the number of residents and the academic time that
Got it.
you allow for people.
Okay, yeah, I'll just go over that part real quick and move on. So we currently have 25 staff neurorads involved with education of fellows and residents. We have roughly 7 fellows a year that we educate, and also around 24 residents. It does vary per year, but roughly about 24 that will rotate through the department as well for educational purposes. We do provide dedicated academic time to our faculty. We start out at 1 academic day per week, and that changes based upon needs for research or grant opportunities, et cetera. To give you an idea about the setting, we have a main campus hospital. It's a 1,000-bed hospital and a level 1 trauma center, and we see a lot of very interesting trauma cases. We also have 2 satellite hospitals, which cumulatively have 500 beds. Both of those are level 2 trauma centers. So in terms of what we're looking for a neuroradiologist to join our group. We have a very respectful and collegial group and strive for good working relationships in our department. We have a few rotations that we all kind of go through. Those are brain, spine. We have an ER rotation, which deals pretty much exclusively with trauma. We have a procedure rotation where we do about 8 procedures a day, which are myelograms and lumbar punctures. And we also have a head and neck rotation. In terms of call, we do 6 call weekends a year and 1 evening shift per month, which is between 4 to 8 p.m. So I'm just going to go ahead and get started with some questions. So could you tell me a little bit about yourself?
Well, I'm a hard worker. I really enjoy being a resident. I've known pretty much from the beginning that I wanted to do neuro, and I've really loved my neuro rotations, and I enjoy being a neuro fellow. I went out of my way to make sure that I would get enough procedural time. It was a little tough during COVID, but certainly I was able to do that. So I'm looking forward to being able to do procedures. I went through a pretty challenging residency. We didn't have a lot of head and neck, but I think that's a very interesting area, and I think that I can grow into that. I'm also very interested in research, and particularly I'm interested in white matter diseases. One of the reasons I became a neuroradiologist is that my cousin has MS. And so I'm very interested in academic career. I enjoy teaching the medical students, and I enjoy the interactive nature of our residency. So we teach each other, and we teach the younger residents. So I really love all of the key elements of being an academic neuroradiologist, and it sounds like I would enjoy being in your department.
Perfect. Could you describe a few strengths and weaknesses?
Well, again, I think that one of my strengths is that I'm a hard worker. I also think I'm a pretty quick study. I think in terms of weaknesses, I'd say that I can be a perfectionist, and I think I can be hard on myself, and I have to watch out about being hard on other people. Another strength is that I think that I have published a couple of papers already, so I think that I know that I enjoy doing research, and I know that I have the patience to do it and to be productive in doing it.
So what would be your ideal job, your dream job?
I think my ideal job would be a setting where I can be teaching every day, at least every day that I'm on clinical service, and where the majority of my time is spent teaching. I like the mix. So I like mixing it up and getting up and putting on lead and getting out of the reading room every once in a while. I think that just helps make the day or the week more interesting. And I think that I like the idea that you have a dedicated, there's dedicated protected time. My ideal job is also working with people who are very good at what they do. And I'm thrilled to be in a department like yours. I would be thrilled to be in a department like yours where I can learn and then contribute in the department. So where I can grow.
Is there any particular modality or procedure that you're willing or not willing, or I guess not willing to do?
Well, I'm hoping that, and maybe you can answer this question, that this is going to be 100% neuro. And,
yes, 100% neuro.
Okay. Yeah, and that's really, I'm comfortable with just about everything. I guess the one thing where I really haven't had much experience is with head and neck biopsies. I know in some places that's, a substantial amount of the practice, and there might be a day dedicated or to a week, or they may just come up every day. So I would have to train up for that, because in the entire time I've been a neurofellow, I've only really gotten my hand on the needle a couple times for those, and they were usually pretty easy, at least easy compared to what I see in the literature. So I would have to get ready for that, but there's really nothing in neuro that I wouldn't do. I guess I should also just check with you. Are you doing angiography as part of your practice?
I mean, we do have like the CTAs, like the cross-sectional, but you mean in terms of interventional angiography?
Or yeah, do you ever do, you know, femoral punctures and do things like that?
No, we have interventional neurorads that do all that, so you wouldn't be
Okay.
asked to do that.
I just wanted to double check because, yeah, I mean, we didn't get a lot of experience with that either. The neurosurgical residents took most of the cases in the program where I trained.
In terms of the head and neck procedures, we do have dedicated head and neck rads that can do those unless you have an interest and you want to participate, but you would not have to worry about doing that.
Well, I just wanted to say that I'm willing to learn to do whatever you need me to do.
Perfect. Is there a particular part of neuroradiology that you would be happy doing every single day for the rest of your life that you're really excited about?
I would say that the thing that I like most is doing adult brain work.
Mhm.
So if I was going to do one thing to the exclusion of other things, it would be that. And I've always been particularly interested in the visual system. So I'm, you know, interested in orbits. I'm interested in diseases of the white matter tracts and the occipital lobes. And I really like doing, we have a very good neuro-ophthalmologist where I trained, and I really enjoyed working with him, and we wrote a paper together.
Perfect. Just out of curiosity, is there, what kind of drew you to our practice? Is something specific that kind of caught your eye, or is it geographic location, family and friends in the area?
Well, it's really several things. You know, I have a significant other. We're not married, but we're in a committed relationship. And so she and I made a very short list of places, you know, geographies that work for us. And this was one of them. So we are very interested. And that's one element of it. It's the reputation of you and your colleagues. I think that I'm much more interested in the people I'm going to be working with rather than the institutions per se, but you're also at a great institution. So that's also a big plus, but it's people first in how I think about things. And, you know, it's also that while many places are cutting back on academics, you're still making a commitment. And at my age, I will not be coming to you with grant money. But my hope is that in the long run, I can do that as well. But at least now I would have time to make good use of that dedicated academic time to try to be productive. I know there's a lot to do in your first year, but I think that will be a big help in me trying to meet all the goals you probably have for your next hire.
Perfect. So a few other questions here. So what have you done professionally that is not an experience that you want to repeat?
That's a good question. When I was in medical school, I briefly thought that I would be a neurologist, and I almost applied to neurology residencies. And I had an experience where when I was actually meeting with the neurology program director at my institution, I was asked, what do you like most about neurology? And I said, you know, it's just how well the imaging displays the pathology. And I think she kind of looked back at me and said, yeah, gave me some very good advice, even though I think she thought she was insulting me, which is, you're probably better off in radiology. So I would not want to repeat that interaction. But I think that it was very helpful to me. So that's one of the things that I haven't liked.
Okay, how do you feel about communicating with patients directly? We're currently developing a new platform which would potentially allow for direct communication between physicians and patients. Is that something you're comfortable with or not comfortable with?
That's actually something I am very comfortable with. I'm a little bit of a non-traditional medical student. I started a little bit later than other medical students. And as you can tell from my appearance, and I think that one of the things that I want to make sure that I don't miss out on in radiology is patient interaction. So I would actually be very interested in not only participating in that, but maybe even in doing more than my share of leading that. I really do enjoy talking to patients.
Perfect. Are you interested in leadership? we have several different options, such as maybe being a program director, quality and safety, or protocol development. Are any of those of interest to you?
Absolutely. I would sort of see that as another way that I can contribute to the department, another way that I can be a valuable member of your group. I don't have a lot of leadership training, but I certainly would be willing to learn, and I certainly would be willing to work the extra time that's probably involved in doing that.
Perfect. Yeah. Well, if you have an interest in leadership, we would be more than happy to support any sorts of training to help you develop and prosper as a strong leader.
Well, I have to be honest. I've interviewed at about 10 places so far, and that's the first time I've heard that. So that is very intriguing.
Oh, wow. Okay, great. Let's see. So are you interested in research? And if so, is there any specific area that you're interested in?
Well, in the papers that I've written so far, most of them are about how inflammatory diseases and demyelinating diseases affect vision. So that's certainly something that I think I would be interested in pursuing further. But I'd also like to look and see what's available, because I think as a radiologist, a lot of our research is collaborative. So I'd really like to meet people and see where the opportunities are to work. And I guess what I'm trying to say is that I'm also open-minded. And if there are interesting opportunities to work with some of the non-radiology physicians at your institution, I'd love to do that.
Perfect. So tell me about the relationships you've had with the people you've worked with. How would you describe the best ones, and how would you describe the worst ones?
I think the best ones have been the feeling that you're on an elite team with other strong radiology colleagues, and you're all working together towards the same goal. And that's a great feeling. It's just an honor to be on a team like that, and it's an honor to do that kind of work. I think some of the worst ones have been working with people who are insecure and who are difficult to work with, and who are sometimes divisive and can undercut you. And that has been disappointing. And unfortunately, most of the people like that who I've met in my career were during my internship. But most of the radiologists I've worked with have been very good people, and kind of people who you can trust and who you enjoy coming in and seeing every day at work. And those are the kind of people who make it exciting to come into work.
Absolutely. It's just so important to have good relationships with others. This is kind of a question that's similar to the one I just asked you, but how have you dealt with conflict with a coworker in the past?
In a couple of ways. We had somebody who was burning out in my residency, and I don't think we really recognized it until it was fairly far along. And there were some bad things going on, and we had to kind of do an intervention with him. And they wanted us as peers to be helpful, and we were, but it was very difficult. It's very difficult to see somebody your age get into that much trouble that quickly. And I think that the leadership in the department really pushed it down onto us as residents to deal with this, which I disagreed with a bit, because I think that they also, had a role to play that they didn't fully take on. But we did our best to help him, and he was off service, and we did, we all pitched in and helped out while that was going on.
Kind of a little out there kind of question, but is it better to be a perfect neuroradiologist and late, or a good neuroradiologist and on time?
Oh boy, I think it depends on how late you are, but it's a great question, because the timing is everything, and there's a value to what we do that, at least in the emergency room and the ICU setting, is time limited. And getting an important read 3 days late is obviously terrible. I think that it's probably an optimization curve where it's better to be pretty close to on time, and pretty close to perfect is probably the best answer, but I don't want to dodge your question. And I guess it's better to not be late. If you're on time and wrong, you may still help somebody else be right. If you're perfect and late, you're often useless.
Right.
And we had a case like this when I was a resident, where we had a case of ventriculitis. And for some reason, it wasn't read at night. And the neurosurgery residents said they looked at the case, but they probably didn't. I looked at it the next morning, called them right away, said that there's pus in the ventricles and this is all awful. And I was right. But in the case of this patient, the delay was, it was really hurt them. So that experience makes me lean towards answering your question with, it's better to be imperfect but on time than perfect but too late to be helpful.
Perfect. Okay, last question. Have you ever had any disciplinary action against you, like loss of a medical license, any issues with societies?
Nope. I no disciplinary actions, no lawsuits, no problems.
Perfect. Any questions for me?
Well, just a couple quick questions. Does everybody in your department, in the division, they're going to be people of different ages? Does everybody take the same amount of fall right now?
Yes, we like to have a good working relationship with everybody, so we try to keep it very fair. So everybody does the exact same amount of call, weekends and evenings.
Okay. And how about the distribution of the day work? Does everybody do about the same amount of work?
It's variable depending upon the rotation. For example, our trauma or ER rotation is quite busy. We get a lot of crazy spine fractures, intracranial bleeds, gunshot wounds. So that one may be a little bit more heavier. Our procedure rotation, you do the 8 procedures, so maybe you might feel a little bit lighter than chasing after all these trauma cases. Spine is usually also on the lighter side. Brain is quite packed as well. So it's really depends on what rotation you're on, but we rotate around. So you may be on a rough rotation, but the next day you'll be on a little bit easier one.
Well, I just have a couple of basic questions for you. Do you read children's brains and spines, or does somebody else do that in your department?
That's a great question. No, we have dedicated peds neuroradiologists that do that.
Okay. Because the place that I was trained, we did a month at the Children's Hospital, but it's very segregated, and the majority of our training was in adult neuro. I just wanted to double check that. Do you use advanced practitioners in your practice?
We do have a few, but not many. Just a couple.
And what do they do?
They're primarily there to kind of assist with doing basic reads, but the radiologist still signs off on the, like they do read some of the head CTs, but they do just a prelim, and then we do the signing off and reviewing.
Okay. And then just another question, just can you tell me about what a typical workday for you is like? How much time do you spend teaching residents and fellows? Do you read cases on your own? Do you do procedures always with a trainee or not? Just tell me a little bit about what it's like to be you and to be at work.
Sure. Typically on each rotation, we have 2 shifts. We have a 7 to 3 and a 9 to 5. And we do try to give you preference if you prefer to be an early person or late. But typically when you come in, there's a list, and the residents will start reading the cases. And then you are going through them, signing off on them. And if you see any issues or mistakes, then you have conversations and go over those cases with the resident.
And are you doing all of the work in person? Some of the places I've looked at, ever since COVID, they've had some people reading from home. How do you do things?
Yes, great question. Most of us are on site, but we do have the flexibility to work off-site. Everybody has an at-home workstation for call purposes. So call is generally done from home, the evening shift and the weekend shift. If for whatever reason you need to work from home on a particular day, it's an option for you to do.
Okay. And what does it take? This is a broader question, but what does it take to be promoted academically? I assume I'm going to start as an assistant professor. What does it take to get promoted where you are academically? How long does it take, and what's the typical number of publications or presentations or grants that you need to move up?
Well, generally for the assistant professorship, it's just a review process. You don't have a required number of publications. But in order to make associate, we do require at least 50 publications.
Okay.
So yeah, it generally, it does take some time to make associate.
And can you tell me a little bit about somebody who didn't work out? And just give me some insights into what might, prevent me from succeeding at your institution.
Well, we did have one faculty member that recently left. But I think essentially what happened is it was just not a good fit. This person moved to our facility and they're from a different part of the country. And so they were away from their family. So that was the first part. But they just, the type of work that they were doing, I don't think they were all that happy about. They started wanting to do more AI type stuff, informatics, which is not really part of our department. So their interest kind of shifted. And so I think ultimately it just was not a good fit. And so they just recently left and have moved on to a job that allows them to do more AI type stuff.
Okay. And another question, and you just tell me when you need to stop, but one other question that I had is, do you as a division, do you ever get together outside of work? Do you know each other's spouses? Do you get together outside of work?
Yes, that's a great question. We really do try to create kind of a family atmosphere. We want everyone to work well together. And so we have every 2 months, we have we have a coordinator that does this. They set up a social hour. It's on Wednesday from 5 to 8. And basically we all go and you bring your spouse, you want to bring friends or whatever. And it's just really an opportunity to kind of hang out in a social setting and spend time together. So yes, we do that every 2 months.
That's great.
So Jen's giving me the time's up text.
Okay. And just for the audience, this happens in the real world. Like when you interview in an academic place, somebody comes and knocks on the door or the phone rings, so they keep things going. And particularly when things look like they're going well, like you just saw, it's kind of jarring to sort of, that's all the time we have, and you have 25 minutes and that's all you get. So, but I want to thank Dr. Nathan very much for doing this. And I hope that this is helpful to you. And we didn't even cover any illegal topics. She was being nice there.
I had a few, but I'm like, well.
No, you had so much good material. Yeah, we didn't even need to get to this. So thank you again. And I guess now they're going to switch over to the private practice sim.
Yep. Dr. Truler and Dr. Moriarty will now do a private practice mock interview simulation. Thanks, guys.
My first question is how many minutes do we have? Because I'm the one kind of running the
20,
interview.
20 minutes.
We still have 20 because we're running a little bit late.
Yeah,
Okay.
It just goes right into Q&A after this.
Okay, Andy, if it's all right with you, I'm going to take the first about 10 minutes to ask my questions. I'm going to throw it to you for 5 minutes or so. And then I figure I want to talk about at the end of this, use 5 minutes or so to ask about why we asked the questions we asked and how to think about answering them rather than just doing it. Does that sound okay, Andy?
Works for me.
What?
Works for me.
Okay. All right. Well, Dr. Moriarty, it's nice to have you visiting Radiologic Medical Services here. As you know, we're a 12-person private practice sort of generalist radiology group here in the Midwest. As you know, we're all generalists, but we also have subspecialties, and we all expect everybody to contribute in the ways they best can. We have both, we may or may not know, we have joint ventured imaging centers with the hospital, as well as privately owned joint ventures. And then we have a number of different private interpretation contracts. So we sort of have a multifaceted business here. I'm glad you're interested in looking at us. And I guess just let me start to ask, what are you looking for in an ideal job?
Well, thanks. I'm coming right out of training, and I have a broad experience. I'm actually going to go into abdominal imaging. I really enjoy doing the procedures, and I like the body imaging aspect of it. I like having a large range of knowledge, and I want to be a general practitioner to the extent that I can really use my fellowship training to help get the best answer to the patients, but still maintain enough of a broad skill set. And I'm excited to learn about your group. You know, at the size of 8 people, do we have enough subspecialty training in the group that if I'm stuck on a case and I have never seen this before, or I look at a case and I know that something is wrong, but I don't know what I'm looking at, do I have someone that can tap on the shoulder and they're going to help steer me in the right direction? Or am I going to sort of have to struggle through that case on my own and just say, well, we're all reading this case, we're all on our own work list?
Well, we have a unified work list. So while we're dispersed across multiple sites, obviously we all have each other's cell phone numbers, and we pretty much expect you to be either looking things up or asking questions of the other partners. We work with, particularly with somebody earlier in their career. I got to tell you, I worry a lot more about a person who doesn't ask me questions and isn't asking for the advice of the older radiologists than the people who kind of blast through the work list and don't ask questions, because those are the ones where we've historically had some problems with folks like that. So no, you'll always be able to access the combined intelligence of all of us. It's very routine for us to be asking each other questions. Not a problem at all. And because our pace is not quite as fast as some other private practices, you'll have some time to look things up if you need to. So I understand certainly your concern about that. But really, you should be all right there. I think we adapt people really well, and they seem to fit in pretty well. You know, that said, you mentioned that you are planning on doing the abdominal imaging. You know, in a private practice, particularly a smaller one, we all kind of have to do most things. Are there any, and since you are applying for a job, we might as well be upfront here. Are there any procedures or things that you are just absolutely not comfortable reading? Anything that we might need you to do that would be a deal breaker for you taking our job if we were to offer it to you?
A deal breaker? No, I think that as a new trainee, I'm willing to learn and expand my skill set. We didn't get the greatest training in cardiac imaging at my facility. I know that's a big emphasis at some areas and not at the others. It depends. I am interested to learn more about how your group at your size approaches interventional radiology procedures, especially the higher end vascular work and call coverage. And I am very comfortable with what are considered sort of minor procedures. As part of why I'm doing my fellowship, it'll include a procedural component. So I like doing drains and abscess biopsies and things like that. I would say that I'm certainly capable of doing some of what sort of middle tier IR procedures, but I am not a high-end TIPS procedure, TACE, and lower extremity stenting kind of person.
Sure. And as you know from our bio, we're not a large community or a large hospital. We are a community hospital. The types of things, you know, you'll be fully expected to be able to do PICC lines, lung biopsies, liver biopsies, thyroids, obviously, the bane of all of our existence. Joint injections. How are you on arthrograms? Can you do small joints? Have you ever had any experience with those?
I had exposure during training, and it was interesting. The facility that I trained at was actually in the process of transitioning to hiring APPs to help out with the workflow. And I don't know. I've heard of other institutions that they end up actually training the residents in some of those situations. And what is your group's philosophy on hiring extenders to help with some of these minor procedures and move radiologists more toward the diagnostic workstation so they're being a little more productive?
So far, we haven't found a role for any advanced practice staff. We have been able to keep it all internal and handled by the radiologists. It really is not that we haven't explored it and that we don't see the potential economic value in that. It's just a matter of we don't have enough volume that we feel like we could offload onto them where they would be able to earn their salary. It's just simply not quite that. You need to keep them fairly busy to justify that, and we aren't quite there. I do appreciate that you're thinking about it though, because that's exactly the kind of thing that in a private practice we have to be thinking about all the time. You know, are we using ourselves to the best possible advantage and all that kind of thing. So I can tell that you have a little bit of a business thought process behind that, and I really appreciate that. So you believe, would you be comfortable doing an ankle arthrogram, for example?
I would be willing to learn.
Okay. What about breast work? Do you do MAMs, breast biopsies?
I did a 6-month mini fellowship because in going into a private practice and expecting a general workflow, I saw that as a valuable add-on to my senior year after finishing the core exam.
Okay, PET, do you do PET studies?
Yep, we do PET studies, and I would be comfortable in doing like that.
Okay, and then lung biopsies, chest tubes under, under guidance, imaging guidance?
Yep, I'm very comfortable doing lung biopsies. I was commended by some of our body proceduralists at my technical abilities as a resident, and thankfully I haven't had to put a chest tube in for a while.
Well, it's not that hard. It's like everything else. It's just you got an image and a tube and a needle, and you can get there. So that'll be all right. What are you looking for in, so it sounds like there's no real deal breakers here. It sounds like we could potentially have a fit here. What do you want in an ideal job though?
Well, I'd like to do around 50% of my subspecialty, but obviously recognizing the need for general work. I'm very interested in comments that you made earlier about pace. I don't know how common it is, the perception of our generation, but I am interested in work-life balance. I know there are a number of private practices out there where you can have a very high income, or you can take a lot of time off. And I'm wondering the group's philosophy, of how do you balance getting the work done with the desire for income and vacation? And, is the group unified on that? Is there a sort of a 50-50 division, or do you have an 80-20 split where the 20% are not happy, but they go along with everybody else?
And are you speaking about the daily workflow? Or are you talking about vacations, or what specifically are you asking about?
I think in the one sense, I'm interested in the overall package. I think the important thing to me is the amount of compensation for the amount worked. And so I'm willing to adjust vacation expectations up or down to have a more reasonable work day where I don't feel that I am in the hospital at 7 in the morning and leaving at 7 p.m. and having run all day long where I don't have a time to call a clinician on the phone or to really prepare for the tumor boards and to make sure I'm doing the best job I can.
Okay. As I sort of mentioned before, we aren't the highest volume group. We'll read about 80 to 100 studies a day in a 9-hour shift. In general, we show up at 7:30, we try to leave at 5 in order to preserve, our free time. A lot of that's because people have kids. I don't know. Do you have any kids, or are you planning on having kids? I don't know. Do you have a spouse or a partner?
I do have a spouse, and we are planning on kids in a little while.
Good, because as you know, this is a pretty politically conservative area. So I hope you know that you're gonna, you'll have to be comfortable in a politically that's sort of an area. We like kids, we like, the home time. Make sure we carve out time for church and all of that. Just some other things. So the volume expectations, would you think you'd be able to do, say, 80 to 100 studies in a 9-hour shift? 80 to 100, say?
Well, it depends on the number of procedures I would have to expected to be doing there, but I think that I could eventually work my pace up there. In our current residency, we have our daytime teaching shifts are a little bit different than our weekend shifts, but when we're on weekend call, we do independent call, and we send out the cases to be signed or co-signed by a staff, sometimes synchronously, sometimes a couple hours later. And on some of those shifts, which are more like 10, 11-hour shifts, I regularly hit 90 to 100 cases. And a typical ER case mix.
Okay, so
I think there's room to grow there, and I'm obviously a senior resident. I have some time to develop my skills.
okay, that sounds about like the volume we'd be doing here. And did you say you've done some moonlighting or had some independent practice experience, or not?
Yeah, we have two options. We have some internal shifts that can be picked up at our training facility, and those are obviously supervised. And then we have an external group with a separate private practice that actually has us final signing and covering the ER ourselves independently.
No, that's excellent. That's a really valuable experience. I did a little of that myself when I was at your stage. So it sounds like the mix, this sounds like the volume is something you could adapt to, or sounds like we should be comfortable. Most of the procedures sound like they match up pretty well. What do you think that have you contributed in your training or your prior experience? What do you think might be unique that you would bring to us beyond just interpreting the films and melting the stack? Is there any particular skill set you have, or anything that might be unexpected that you could contribute to our, our combined future? Because, in private practice, once you're a member, we're all in this together. So, we really need to work as a team. So what do you think you could bring that might be different from somebody else?
Well, that's actually what I'm really interested in learning more about your group. I obviously am coming from a residency. We're a medium to large size residency. I would think we have 8 to 10 people per year, depending on the class year. And I've noticed that we're very close knit within my class. And I'm looking for something similar like that in private practice where everybody works together. I have noticed what you mentioned about what do the individuals bring in our particularly residency class. And so I've kind of cultivated for my personal self what I would do. I think having a broad general skill set is important. I think that I am going to fellowship to learn that higher end MRI and expertise and grow programs. I'm looking at our center is accredited for some of the advanced prostate MRIs and rectal MRIs, and they're all, it's the place where I'm going for fellowship is always developing new protocols. And so I'm hoping to learn some of that and bring it back and to be the person who is either the go-to person at the private practice, or if that particular imaging modality is not there yet, then I would like to develop that service line and see if I could interact with the referring clinicians to get some of that business and grow the program. So I would want to learn a little bit more about what your current needs are. Obviously, I'm interested in body imaging, so it would be related to that, but I'm willing to take some things that I learned from my fellowship and really spend a year developing that so that I can bring it back and be a valuable contribution to the group.
In private, but we only have about 2 minutes here before I want to break out of this. Do you have any, now obviously we're private practice. That means that if we were to offer you partnership, well, we can talk in the future after this first round of interviews about what your expectations are for buy-ins and for years to partnership and things like that. Do you have any expectations that you can share with me right now about maybe you've heard from your friends or done some research on what you are expecting for years to be offered partnership, and then what a buy-in expectation might be financially?
Yeah, and I know we only have a couple minutes, but obviously I've been on a couple of interviews and I've talked to some of my cohorts. I feel like, being up front, the radiology job market is strong right now. And it's definitely recruiting season. I've heard most groups are offering 1 year to partnership, some in 2, depending on it. I think that I am looking for a group that has technical component. I've heard some of my colleagues refer to that as passive income, and I do have a little bit of business experience, and I kind of correct them and say, well, it's not really passive income; it's a second job. But if you're good at it and you can manage it well, there's an area to sort of diversify your income and to really help supplement what you do as a clinical radiologist. Bring some of your expertise to a separate service line or business that could potentially pay dividends. And so I'm looking for a private practice that's fair and equitable. And I'm trying to make sure that all the partners are treated equally and that new hires are brought in with the expectation that you will eventually join as an equal partner. I would like to wonder what the group's plans are in terms of defending against employment by the hospital. It sounds like you have a long history of being a private practice group, and I do have a little bit of interest in personal finance and business. I did research your bio on the website, and I saw that you won the White Coat Investor Award, which tells me that you must be doing something right over at that practice. But how do I have assurances that the group will remain independent, both from a physician-owned perspective and not taking an employment position from the health system or an outside investment that might change my partnership status in the future?
Okay. And I'll tell you what, Andy, I'm going to shut it down there because we just got an alert that we have 5 minutes to go. And I know both you are a fantastic interviewer because you've probably done a lot of this, but can we go through this real quick? I want to hear your opinions too on these questions.
Let's do it.
The first thing I want to mention to everybody else, when I asked the question about, is he going to have kids? Is he married? That's an illegal question.
Oh yeah.
We are not, I'm telling the group here. So I segued into that because I saw an opening. Technically, they are not supposed to be able to, and Dr. Alexa, chime in, but you're not supposed to be asked if you're planning on having children, what your religion, what your political affiliation is, left, right, none of that. But you have to have something ready to be asked or to answer if asked. Okay.
Yeah, I will share, one of my interview experiences actually as a 5th year resident was I went and interviewed at someplace And it wasn't a conservative town. They had a realtor that took you on a tour to sort of get you in, and they made sure to point out every single church and that you know, what denomination you were if you were considered moving to that town. So you have to be able to answer those questions.
Yeah, I mean, it's a real thing. So Jen, how many minutes do we have left? This is for Jen, Nathan.
You are okay. Yes, no, you're okay. I was just wanted to let the breakout rooms know that they should start wrapping up in about 5 minutes.
Okay,
Hey,
well,
Scott, real quick, I thought another interesting thing that you said during your interview was you also brought up religion, and I believe that's also illegal too.
absolutely illegal, absolutely illegal. But I'm just saying that doesn't mean it won't get asked.
Right.
Because particularly in a private practice environment, I think in university settings, you get a lot more HR training, and I'm not sure that's the case necessarily in private practice.
Mhm.
So just be aware. If you'll think, oh, they won't ask me about that. Well, they might. So just to the audience, think about how you might handle that in a finessed way. Andy, let's see. So Andy, when you interview people, do you ask what they're unwilling to do in terms of procedures?
Do I ask? I
Not like-
actually have not thought about that question before. A lot of our interviews focus on trying to find if it's a good fit for the group, and so probing on people. But we're, you know, I obviously applied to a small private practice here, but my private practice group of 220 radiologists is a little bit different, and so we have a different expectation when people come in to interview.
And so for the crowd, like that will be very different. I mean, Andy's in private practice, I'm in private practice, very different private practice environments. You know, one's huge, one's tiny for the modern age. Andy, do you guys have a buy-in?
We have a minimal buy-in because we don't have technical.
Okay, my group has technical, so ours is a couple 100,000. I mean, now I say that, but there's ways we make that so it's not a very punitive thing to actually have to pay. But Andy, would you be offended if you were asked what the buy-in is by a potential applicant in an interview situation?
No, well, because one of the things I was trying to get to at that last question is, you know, how do we make sure that everybody is as fair and equal, right? And it depends on your size versus mine. One of my phrases for my group is, we all do very different jobs at this scale, and we all want to be treated fairly, even though we can't do the same job or be equal. And so for the buy-in part, you know, I'm very upfront and honest. You know, it's an honest accounting done by an outside company about what the value of our hard assets is, and that's what you buy into. And the rest of it is sweat equity, depending on how long your partnership tract is, right? It's you spend a couple of years working in the group before you become partner.
And to the audience again, since we're really here tonight for the trainees in the audience, yeah, my group is the same way. So the key thing is if somebody mentions partnership, or if you decide you're going to ask about it at some point, which is a totally legitimate question, not the first question you ask, but it's a legitimate topic. The key thing is, if you were asking me and I'm interviewing you and I'm like really dodgy about it and don't really want us to talk about it, that's a red flag. But what I would say is, well, my answer, it's the same way as Andy's. We do it based upon the depreciated book value of the hard assets of the business, plus your percentage of the accounts receivable. That varies day by day. Your amount buy-in will be calculated the day you become a partner, and that will be the amount. And ours is higher than Andy's because we own imaging centers. I own big steel, big super cooled steel. And so, you know, we just own stuff and get that technical revenue. And so it'll be a different buy-in. It's a fair buy-in, but there is one. So the key thing is, in a private practice, the very big difference here is we are actually in businesses, and you're buying into a business like a Taco Bell, you know? And so there's much more of a business flavor to things, and we think about things in that way. Andy, was there anything you wanted to ask? You were thinking about asking that you didn't get a chance to? We're about out of time.
Yep, I think we have 2-3 minutes left here. So yeah, I was trying to get at the end about how to one of the concerns that I hear a lot from interviewees or new people is, you know, how do you plan to stay independent? And the subtle massaging of that, of what sort of clause do I, or sort of recourse do I have in my assurances do I have in my contract that something won't change while I'm in the partnership build-up period.
And, you know, Andy, the way I've told trainees before, I've suggested, like, if I was approaching that, I'd be like, oh, I hear a lot from my other trainees who are looking for jobs about places, and they're worried about places selling to private equity or large corporate groups. Have you guys thought about that? just kind of putting it out there. And so it's, thoughts, kind of like that. Is that what do you think, Andy? Would that be a good way to phrase it for somebody applying for one of your jobs?
Yeah, I mean, I've had people say, how would you approach that? And we give the honest answer of we've looked at it and we've evaluated it, and the business case doesn't make sense at our size and scale. Obviously, we've invested a lot in ourselves, and we like to keep it that way. We believe that the practice is best run by the practicing radiologists, even if that is 200 Democratic voices trying to decide the best way to do a job.
Yeah. And in our business, we say, well, we have no intention to do it because we just prize our independence, but also we've affiliated with Strategic Radiology, which is a confederation of large private practices in America. And we get a lot of the benefits of a large organization by being affiliated with that. And it's specifically set up to encourage and maintain private practice in America. So if Andy's asked that question, he has an answer for it that's honest to his group. If I'm asked it as my group leader, I have an honest answer for that too. I think the problem would be is if they go like, well, that's an interesting question, and we'll deal with that when the time comes. I mean, if I got that if I was applying for a job and that was the answer, and I'm looking for a long-term home, I would not be comfortable with that answer. That means that they're looking. Now, if they're honest and say, we're interviewing with one of the big ones right now, well, they're being honest with you. So the key thing is just feel like you're going into, I would say, going into an honest situation.
And that opens up a whole nother questions, but you and I have another thing in common because we're also in strategic radiology. And we believe in that. So I think Jen's telling us to wrap up. So we'll probably bring everybody back to the breakout room, and we'll turn it back over to Jen, Nathan, and Dr. Alexa.
Yeah, this is fun. We could do this for 2 hours.
Dr. Nathan, Dr. Alexa.
Well, great job. That's fantastic. You guys did a great job. And Jen, do you want to lead the Q&A?
Sure. All right, so now we're going to move on to the Q&A session. So we'd like to open up to all our participants. You can ask any of our faculty members any questions. Just raise your hand, or you can type a question in the chat box. I can go ahead and ask it for you.
I don't see anything in the chat right now.
Okay.
If there's no questions, Dr. Alexa, do you want to speak to illegal questions?
Sure, I can just do that while we're waiting for things to get started. And it's something that we didn't have time for because Dr. Nathan had so many good questions that we didn't get to any of the ugly ones. But typically, and just to follow up on the discussion that you just heard, one of the things you can run into, because sometimes people sort of naively asked, has your practice been approached by a private equity company? And first of all, the answer is yes, they have, unless they're a really, rough practice, maybe someone that, nobody wants to buy. But most people aren't going to be able to tell you if they're really in play because many times they've signed an NDA. So I just wanted to clarify that often it's a question that people might want to answer, but they often can't. So you should just assume that it's in play, and you might go through the scenario that you just heard of, well, what would happen if? With regards to illegal questions, even though I gave her a couple opportunities, Dr. Nathan didn't go in on an illegal question, which is, what does your wife do? Are you married? Do you have children? Those are all not. Are you pregnant? What's your sexual orientation? What kind of a name is Lexa? What race are you? Those kinds of things. Those are all things that are illegal. At the federal level, there are other things that are restricted at the state or institutional level. And some institutions are not allowed to ask you if you smoke. At other institutions like Penn, that's one of the things they do ask you because they're not hiring people anymore who smoke, and they will give you a urine test. Yeah, exactly. I see some surprise in some of the faces on here, but that's true. And that's a copy of something that I think they started, Cleveland Clinic did that. But I can fact check that. But the point is, those are some illegal questions. And then there are other questions that, you just might want to stay away from. Like, you probably should, unless somebody is visibly wearing jewelry or clothing that somehow identifies them religiously, you should just don't ask them their religion. Don't assume. Ways that people sometimes get around the question of, can you take call 7 days in a row, or can you take call on any of the 7 days a week? Those are legal questions, but don't ask somebody their religion. That will get you in trouble. And most of the trouble begins if you don't get the job. If they give you a job, they didn't discriminate against you, or maybe they positively discriminated towards you. But, if somebody doesn't like the fact that I have a Czech name and they hate Czech people, then that I would theoretically be able to call somebody in Washington and sue them. But those are some of the illegal ones.
We got a few questions that have rolled in here. Let's see. So our first one is, what are the top 3 things you should ask any radiology employer? Anyone want to take a stab at this one?
I would just say you got your, what exactly is the schedule? What exactly is the call burden? Is there differences in call burden and schedule between senior partners, junior partners, senior staff, junior staff? And what exactly does that look like? They should be able to commit to, or that should be very clear. Because that's going to dictate your happiness of your life right from the get-go. That's where I'd start.
And that's true for, and it's interesting you have to say that, because I have tried to ask those questions back when I was first coming up, and you often wouldn't get straight answers. And yet in most jobs, it's one of the standard things people ask. How long do I work? What am I going to do? Another thing that you might ask is, are you growing? How long have you had your contracts? Why is this position open? You hope it's a growth position, but if they just fired somebody, then you might gently ask the question that I asked Dr. Nathan, which is, can you tell me why someone didn't work out in your group? And that's a much more polite way than saying, why do you fire people? Which is probably not the way you want to handle it.
Yeah, I really like the why is there an open spot, right? Because that could talk to a lot of different things. It could talk to growth. It could talk to somebody who didn't work out. I think that the other questions really depend on the private practice and academics. I mean, one of the big things I think ask about, or people should ask about, and I try to ask our candidates is, what's the fit going to be like, right? Are we trying to doing the whole interview to try to assess fit? And one of the big things we talk about from a candidate's perspective is, how do you adjudicate differences of opinion in a private practice, whether that's 8 people or 200? And I think in the academic departments, I don't have experience with this, but it's probably a little more straightforward, right? The chair decides, or somebody with authority decides. But in a private practice, that can get a little bit different.
Any other comments?
Dan Singer here. I also would like to ask a good question for the residents when they're interviewing, is ask how many people have left in the last year. Or what % of the practice is left. A lot of big groups now, you're going to get numbers, if they're honest, 10% or more, and that's going to be a red flag that something's going on. But more and more groups are facing this across the country. So it's important to get that out during your question asking. There's even groups where it's higher. We're hearing now 20%, 25%. Thank you.
Any other
Yeah,
comments?
great point.
Jen, I have one. I'm David Boyd. I would just say for those people considering private practice, not to beat a dead horse, but ask if they're considering selling to private equity. I just think it leads to a good conversation, and I just think you should ask it.
So our second question is, in terms of the practice of interviewing, do you think it should be done at the home facility or use an external service? I know in this day and age too, they're doing a lot of virtual interviewing. How do you guys feel about that?
Well, I think it's always best to see what you're getting into. And I think the best way to do that is to be there. I think that we're, at least in most areas of the country, getting past the prohibition of traveling, or in many places, even people don't wear masks anymore. So I think if you can be on site and see what's going on, that is far more important than any information you can get from Zoom.
Yeah, I would second that. And I would also say that having consultants in between really changes the tone. And since many academic postings have consultants involved, without sounding too critical, but I'm going to be pretty critical. In the end, the consultants aren't with you in the reading room. And many times the consultants have their own agendas, and I think it distorts, in some cases, who ends up getting hired, and it certainly makes finding the right person. I've been on both sides of this. And it's just, they insert themselves in the process, and many times to the detriment of finding a person who'd be a good fit.
Any other comments? Our next question is, how important is it for the resident or fellow to be coming from a pedigree program, trying to get to a competitive private practice group?
I think a pedigree program opens the door. I think you have to go through that door and you will be judged accordingly. But obviously, if you are in one of the top-notch programs and in an area there that the group is looking for, that is beneficial. And I think it would be silly to say otherwise, but that doesn't guarantee the job. You have to then present yourself once that opportunity is given to you.
Any other comments?
I would just say it's, for my group, I think a top-notch one would make maybe a lot more sense for Andy's group. In my group, we're much more of a generalist group. So if I have somebody applying from Penn, my question is, why are they coming here? That's not a serious application. They need to go someplace where they can use their, their super awesome training. I need somebody who shows up, can do the work safely, and is honest. So I would be concerned. I'd be like, listen, you're from Harvard. That's awesome. But I'd consider you a flight risk, because I don't know what I'm going to be able to offer you that's going to keep you happy. So that would be like one of my first questions. Why do you want my job?
Any other comments?
Well, maybe they want your job, Scott, because they have family in the area, or they believe that they can bring a procedure or a type of study that would augment what you're already giving. I wouldn't poo-poo people from Penn or Harvard as being dishonest just because they're applying to you. I think you're downselling your own practice. Just again, my thought.
And I would agree. It's not that we wouldn't hire him. It's just I'd be curious as to why somebody from the East Coast would want to come to the Upper Midwest.
That's reasonable.
Yeah. So
I think
this Dan Singer, the market's changing where, I've heard that now job postings to the ACR went up 40% in a year. So everyone's out there recruiting. It's hard to recruit. So we're opening up to almost all comers, and we like talking to different people, no matter where they came from. And eventually somebody fits the bill we're looking for and wants to be where I am in South Florida, and it works. But the days of going after specific programs are over. When I was in Ohio, my group there, we almost only recruited from University of Michigan. And that went on for 25 years. That's not the case up there anymore.
Mm-hmm.
Yeah,
Thank
I was
you.
going to say it depends. Dan's group is a perfect example. I heard of a group where they only recruited from 3 or 4 different facilities, but they were a small private practice and they had long-standing ties. And everybody who went to that group of 15 to 20 people had trained at one of these 3 facilities, and you couldn't get a job there if you didn't have that stamp. But other groups, and it just depends.
Well, certainly when I was coming up in private practice, there was one group in the Phoenix area that was known as Penn West, which does fit the description you're providing. And then also there was just a notion, and I try to emphasize this when we talk about looking for jobs, and obviously right now you have too many jobs to look at, because as you say, they're like whatever they're up to now. Like there are 4 or 5 times the number of jobs and they're going to be graduates this year. But one of the things that would happen is that the best jobs in America weren't being advertised. They don't spend a lot of money on consultants, because the last thing you want to do is look at a whole lot of people who aren't a good fit. You'd rather do a more, kind of artisanal, curate the search and look for people who you think are going to be a good fit. And it gets to the point where it's almost too inbred, but that can happen too.
Okay, our next question is, should you get into the logistics of maternity leave when you're being hired? I guess asking if how many weeks you would get from maternity leave, is that something that you should just avoid? Any takers on this one?
I can tell you what my wife would say. She would say, just wait and ask the question when it comes up, because there's so much prejudice in some practices against women. It just depends on where you are. And there are definitely some people who are prejudiced about this. That's why they're not supposed to be able to ask the question. But it's up to you. I mean, in some academic places, they will proudly tell you. It's also easy to look it up in an academic place, but with a private practice, it's going to be up to the practice to make these rules.
Yeah, I agree with that, Frank, but I was trying to say and didn't realize I was muted the first question when it said, what should they ask? And I think the most important thing is, what do you expect of me? What am I going to be doing or not doing? And, what should I expect? And I certainly wouldn't ask about maternity leave on the first interview, but I would certainly ask before I took the job, because if I were planning to have a family and I took the job and found out that the group didn't offer anything other than you can use your vacation, I would be very unhappy. And I think unmet expectations on both sides are probably the major reason why people wash out of practices early on.
No, I hope everybody's hearing that, because I think there are questions you ask at the beginning, there are questions you ask at the middle, and there are questions you ask at the end, and you got to get the timing right. I almost tried to throw Dr. Nathan off when she was interviewing me and just, well, what do you want to know? Well, how much do I get paid? What's the dental plan like? If you open with that, you're going to come across as a very odd person. And first I would suggest first you want to get a good understanding, gauge your own interest. And then if you are interested, get them interested in you. And as it moves forward, then you can ask questions about vacation and insurance and salary, length of time to being a partner, all those other critical issues.
Yeah, I agree with that. From a personal experience, I agree that I don't think it would be one of the questions to ask on the very first interview, but probably if you want to go for a second visit, then you ask other questions. But it's your right to ask. It's your right to know, because it might really affect your decision, and when you want to start a family, or affect your decision if you want this group or not. And you want to know, are you being offered to take your vacation? You're going to be left with nothing for the rest of the year, or are they offering you short-term disability, for example? Can you afford? Do you have another, source of income in the family, and can you afford to be on short-term disability? And how long is that going to be? And from a personal experience, I asked the question on the second visit, and they know they're about to hire a young woman who wants to start a family, so there's really nothing to be afraid of, and they should be ready to answer the question. And they offered a short-term disability, but the time when I had the child, it was the time of renewal of contract. So what ended up happening is that they finished that contract and terminated it, and I remained unemployed for 3 months without health insurance, and then they re-employed me again. So it's something to consider, and that's very important to think about before signing with that practice. So I agree, not the very first time, but definitely it's your right to know and to help you making your decision.
Any other comments?
Hey, Dr. Alexa, would that be something that'd be should be defined in the contract? Or how does one find that? Or Dr. Muroff, I mean,
Well, I've never seen it, well, shouldn't say it. It typically is not in your employment agreement, but certainly it should be in your practice policies. And it should be available. And Rend is absolutely correct. I don't think you should take a job until that is clarified. I mean, you don't want to be in the situation that she found herself in, which is having no insurance. I mean, it must have been a group of Grinches, but still in all, it's a fair question to ask, but it shouldn't be the first one. But it's not
No.
typically in employment agreements that I've seen, but it is available in the policy handbook or whatever they have.
Yeah, and in an academic place, it's in the HR handbook,
Right.
and it's spelled out.
Yeah, I would just say it's interesting. It's from the private practice perspective. I sometimes get these questions from our partners who say that you can't do X because that's not in my contract. And I say, well, you have to really look at your contract again, because we all have the same one, and it says you are an equal partner and you will perform the duties as the corporation needs, period, end. And then everything else, like Dr. Muroff said, is through policy, right? So when I joined, we didn't have a policy on paternal leave, and it was, you could take some vacation and you could find some people to cover for you. And through the ACR recently endorsing that practices should strive for improved maternity leave, that's one thing we're tackling now. And it's working through our HR committee, but it will be a policy eventually, and it will define exactly what people get. And so that's one more vote for make sure you understand the job you're getting and that it's the job you want.
But Andy makes a very interesting point. Your practice doesn't have a policy prospectively. Then when it has to deal with it, it tends to either be too punitive or too permissive. And furthermore, it sets a precedent. So if Mary Sue gets 12 weeks of pregnancy leave or family leave, then Sally Joe has to have the same thing. So rather than act on the fly, practices are better off if they deal with these things prospectively before they're needed.
I think we're getting kind of towards the end of the hour. Just time for one more question. The last question is, do you have potential responses to skirt an illegal question without ruining the flow of conversation? How do you handle those difficult questions?
I guess I'll jump in, but I'm sure everybody else probably has some examples too. But when I've done the interviewing talk at the AARP, people immediately come up with illegal questions. And in fact, if you ask for a show of hands, most of the hands in the audience go up. And these are people who are not even in their first job yet. These are residents and fellows. So illegal questions are pretty common. My wife says she was asked an illegal question at every job interview she's had at one time or another. I think that it's better, instead of getting angry, to just sort of say, well, my significant other and I haven't decided when we're going to start a family yet, if somebody asks that. If somebody asks me what kind of a name Lexa is, I say, oh, well, I understand that it's a little bit unusual and you may not have met anybody else with the name because it was changed at Ellis Island. And I tell them what it is, and it's not a big deal. Also understand that all the illegal questions are vacated if you put it in your essay. So if you talk about your sexual orientation in your essay, or somebody puts that into a letter of recommendation, that's now a legal question. And if you bring it up, it's now legal. So if you say, well, I chose to be a doctor because of my religion, now your religion's on the table because you brought it up. So it's I'm not an attorney. Dr. Muroff knows way more about the law than I do. But it's considered a shield, but it's not a sword, meaning it protects you from them, but you can't use it affirmatively. So that's the point of the story. But just be polite. Don't get angry. The stupidest question I ever was told from AARP was somebody who said that when she was applying for fellowship, somebody asked her if she had little children and her husband was killed in a car accident, would she have to drop out of the fellowship? Anybody want to guess what kind of a fellowship it was? It's IR. That's always the answer for these questions. Sorry. The point of the story is that I told her, because she actually asked me, what should I have said? Because this really seemed to bother her. And my sarcastic side would say, I would never come to a place that would let somebody like you interview me. But that's not the right answer. The right answer is probably just to say that I just can't imagine losing my husband. I'm very dedicated to my job, and then change the subject. Just because you'll be interviewed by stupid people, and you'll get illegal questions. And most of the people, we don't train people how to interview. If you interview for a corporate job, they'll work off a script and they're highly trained. The people who are, training you, are going to be interviewing you, are often just people who have to do it, and they're not very interested in it. And we had older people we had to take out of the interviewing pool because they kept asking really crazy questions. Like the worst one was, what kind of an Oriental are you? That was like the dumbest thing that anybody ever said. I moved him out. I explained that we use that for carpets, but not for people. So just, that's the end of it.
Any other comments?
I want to say that, and this is just a personal opinion, don't make an impression or a final decision about a practice just because of a single bad interviewer, I would say. It happened to me in the past, and I feel like what I did is, instead of saying this is not the practice that I want to come to, but I actually shared it with the president of the group, that this thing happened at that interview. What is your impression of that person? And maybe they will share something with you about that specific person, or you're never going to have to work with that person. So maybe that would help you with making your final decision about the practice you're interviewing in.
Great advice.
Any other comments? Okay, so we're going to go ahead and conclude. So I just want to let our participants know that there were some questions we did not get answers to, but what we're going to do is share those with our faculty, get their responses, and then we'll send them out to you so you'll still get your question answered. So now I want to thank all participants for being here tonight. I want to thank our stellar faculty for donating your time and talents on such an important topic. So just a few housekeeping things to mention. Be sure to download and save mock interview questions for future use and preparation. You will also receive the annual Kickstart Your Career alumni newsletter, so you will have access to these and future resources as well. Do you want more guidance? Well, sign up for a mentor on the pre-recorded presentations and resource page. Application deadline is Friday, October 21st, so coming up pretty soon here. And please share your feedback. Complete the post-webinar survey and tell us how we're doing and what other areas you'd like us to focus on. So with that, I want to say thank you to everyone and have a great rest of your evening.
Thank you all.
Thank you.